Hi, welcome to one of our Healthy Home videos. Today we have with us Dr. Shellie Russell from Akron Children's Hospital. Welcome, Shellie.
Thank you for asking me to come and talk about lead.
That's specifically what I'd like to talk about, and I feel that this is something that people need to know more about. And I know there's continual studies going on, and I was wondering if you could tell us kind of what's going on with the medical industry on the status of lead in children.
You know, we have a really interested population right now as far as pediatricians in the medical community because of what happened in Flint a couple of years ago.
Absolutely.
And how one wonderful pediatrician figured out where all of this toxicity was coming from. We always have lead as a concern when we're doing our well visits, especially for our kids who are 1 and 2 years of age, because lead is so dangerous.
And where is that lead usually coming from? It's usually not from the water, right?
Correct. So, a lot of those kids are coming in contact with dust and paint that has some lead in it, because they're the ones that are crawling around on the floor, putting things in their mouth, and it builds up in their body very easily.
Now, is lead poisoning like other poisoning, like if you have a bacterial poisoning, you can get over it with some antibiotics? What happens with lead poisoning?
So lead is definitely one of those toxins in our body that we know can cause a variety of problems. Lead is one of those things that has a lot of impact on our physical well-being. It can cause things like seizures. It can also cause significant anemia. That's where the hemoglobin drops down very low and can cause a lot of issues with fatigue and paying attention, especially in school. People can become very disoriented, having a difficult time focusing, changing their demeanor. And so psychologically, it makes an impact. And then most recently, we've had some great studies that have been published that show an impact longitudinally. There was this wonderful study that just recently was published in the Journal of American Medical Association after looking at this cohort of 1,000 people in New Zealand, that exposure to lead definitely changed the trajectory of a person's life forever. The cohort followed people for 30 years, and so these people who had a significantly higher lead exposure had a lower IQ. So fast forward 30 years, we see that those people who had the lower IQ are in lower paying jobs, have had much more disruption in their home environments, and so that's one impact of a child's life that they really don't have any control over, that makes a huge impact on their future.
So other than just having the sickness of lead poisoning at the time, what you're saying and the study's saying that it could actually affect them for their whole life.
Exactly.
That's amazing.
It is. Now, there are some things with the study that, of course, we still need to tease out. Things like the Flint exposure. We think that was a short-lived exposure as opposed to like a chronic exposure with lead-based paint in the house. The amount of the exposure and the duration of the exposure can make an impact. In fact, the American Academy of Pediatrics feels like any level above 4 is very significant and needs to be addressed.
The report that you're referencing from the Journal of American Medical Association, do they give any recommendations on what to do with this lead problem?
They do. These are recommendations from a professor at Harvard, Dr. Bellinger, who said that definitely it is really imperative that we look at more stringent lead abatement efforts, more rigorous screening, more determined cleanup of the vast reservoirs of lead that remain in the environment in everything from paint to plumbing. And making sure that we also have educational interventions to help improve outcomes for lead-exposed children.
And I think realtors and buying or renting a home I think that's a good time to assess if there is a problem in that environment.
Absolutely. And I think it's certainly important for everybody to continue to keep lead on their radar.
I love this information. It actually brings to light that this isn't just something that just happened one time. Once it happens, it could actually affect your whole life. Do you think it's a prudent thing for people, if they're moving in a home, to actually have their home tested for lead-based paint before they move in?
Absolutely. And I don't think that we educate home buyers. We don't educate parents enough about monitoring the environment that their children are growing up in, and once again, how it impacts their future forever.
Well, thanks, Dr. Shellie Russell. I appreciate you coming in and sharing this report with us. And stay tuned for our next Healthy Home video.